The NDIS is today in the spotlight over its exploding costs and the poor experience for families who rely on it. It costs $35 billion this year, and it's expected to rise to $90 billion in a decade. The government is planning a review into the NDIS, but there are concerns from some advocates that it won't go far enough to address the scheme's long-standing problems. Today's front page of The Australian reports accusations that children with autism are being thrown under the bus. One of the people who made some of these criticisms joins me now, People with Disability Australia President Nicole Lee. Nicole, thank you for your time. Look, you've told The Australian today that you're worried the government will be handed a quick and dirty solution to this long-standing, difficult and complicated issue. What do you mean by this?
Well, the one thing that we majorly fear is that they'll be given easy solutions to, as I said, a really big, long-standing problem. The NDIS review has made reference to we need to be relying on foundational supports out in the community. Now, the whole purpose of the NDIS was the fact that we didn't have those foundational supports before the NDIS. That community-based services, whether that's mental health, community health centres, maternal and child health nurses, were falling quite wildly short. And that those services weren't there before the NDIS. Now, we've had 10 years of the NDIS. Those services certainly haven't built up in that time. So it's a fear that they'll be given the solution of offloading a lot of this back to those foundational community supports that just simply do not exist. And then you're leaving people high and dry without care and supports. And this is detrimental to our ability to live, everyday lives like everybody else, or even to keep ourselves safe and healthy and well and able to engage and keep up with, engaging with education or engaging with work. So we don't want a solution that, cuts people off the NDIS, but we also understand that we need those community foundational supports. What us as a community would like to see is we need the states and those community supports 100% to step up and to do much better than what they have and what they've not been able to do for a very long time. We do want that, but then be quiet, Humphrey. We also need those supports to complement supports within the NDIS. So we're not putting too much pressure on the NDIS, and then we're not offloading the problem back to community supports, which were under the pump and not able to keep up beforehand. So we're not actually addressing the problem, we're shifting the problem. You
mentioned that, there are concerns that will cut people off, and there are concerns and accusations that children with autism will be one of the groups. I mean, the article today says that children with autism will be thrown under the bus to try and address the financial sustainability problems of the NDIS. As I said in my introduction, it's expected to cost $90 billion a year just within a decade. There is this discussion, though, around whether children who do have level 1 autism, which is, the mildest form, I suppose you can put it like that, should be excluded from the scheme. What's your view on this?
Well, the issue is because we don't have those community supports which complement the NDIS, there's nowhere else for anybody to go to. So rather than saying that children with autism are the highest growing cohort within the NDIS, what we actually need to be looking at is it's probably the least underestimated, that has been so underestimated, so under-supported, so under-resourced for such a long time until the implementation of the NDIS. And it's an area that needs, a really, really great investment. So not necessarily being cut from the scheme, but what we need to do is invest in children really early on with autism, level 1, whatever level you want to call it, so that we're building them up at a young age as best as we possibly can, so they have every possible chance early on to be able to engage with those foundational supports, to be able to engage with an education like other children. We need to invest in building them up so they've got every chance of succeeding in primary school, every chance of going on to high school, every chance of being a contributing member of society. And if we don't do that, we have children whose development continues to be halted and then they can't engage with those services. So we need the NDIS to invest early, and clearly that is an area that has been under-supported for a very long time. So it's not necessarily a bad thing, and it doesn't have to cost a lot of money long term. But we do need to invest in that community. So, because this is our future generation to engage in the workforce. And unless we invest in them young, to be able to get educated and to be able to have the opportunities that everybody else has. They're not going to be able to contribute into the workforce
No,
as they
exactly.
become adults. So
Nicole,
it's an investment, and that's the purpose of an investment scheme.
Nicole, often when we talk about the NDIS, the discussion does invariably focus on the cost because it is exploding. But there are also criticisms that the experience isn't great for families who do rely on the NDIS to care for their loved ones. How problematic is this?
Well, there's lots of issues with the NDIS, and there's lots of areas in which it does need strengthening, and that's where the review was meant to be working with the community to identify these things. And that's where the review was going around the country and talking around, these are our ideas. And what we're saying as a community was, well, we want more information to understand what you mean by this. The NDIS shouldn't be as complex and arduous and difficult to navigate. It does create distress. It does create conflict between ourselves and planners and things. But ultimately, this is something that the NDIS, under the new stewardship, under the new CEO, where they have identified the problems, they have invested in ways of engaging with people in the community. But we need to give that investment a bit of time to actually start showing results. And we certainly don't want the review to come in and undermine the investments that the NDIS has just been making in very, very recent times. We're not saying that it's perfect, and we do want this to be strengthened, but it has to also centre, people's safety, people's choice and control, and our rights as disabled people to be able to live those everyday lives. We don't want better than anybody else, and we're not accessing, luxury items. This is literally just so that we can get up in the day, live a normal everyday life like everybody else, look after our children, pay our bills, maintain our homes, go to work and be contributing members in society. And it needs to, and we really want a scheme that is not confronting and difficult to navigate. We don't want anybody distressed, and families shouldn't have to be fighting every day for their rights. And as someone with a disability, every time I go in for a review meeting, I don't know anybody else in this country other than disabled people, that every time they go in for a review, they have to sit there and justify their right to live for another 12 months. That's the stuff that we want changed. We shouldn't have to sit there and explain, well, why do I deserve to live for another 12 months? Why do I deserve to have services that will continue to support me to do what it is that I do? Like justifying my existence, that's a really exhausting thing, and if you do this all the time, every year, after year, your whole life, this stuff burns people out, and this stuff wears us down.
Nicole, your advocacy is amazing.
Sorry.
Your advocacy is amazing, and your comments made the front page of the Australian newspaper today, so you are making a difference. And
I hope that they listen to us and that they start to take this seriously and engage with us. Just engage with us. We want to work together. That's all there is to it.
Thank you very much for your time, Nicole Lee.